Hey guys, it's Dr. Ashley Southard here, back for another episode of WeighOut Wednesday. I'm coming to you from Scottsdale, Arizona. I'm the site director and clinical therapist at a New Beginning Outpatient Treatment Center and the co-founder and program director of the Healthy Way Out Emotional and Binge Eating Weight Loss Program. Now, this month, I'm dedicating all of the WeighOut Wednesday episodes to talking about how we can support the next generation in their struggles with emotional and binge eating. So, if you are a parent or a caregiver of a child and you have concerns that they may be misusing food and overeating, then these episodes are for you because I really want to help you not only understand what might be going on for this child, but also give you some tools for how to help them in the way that's going to be most effective and, most importantly, not backfire into more disordered eating. So, today I want to talk about the importance of putting together a professional treatment team to support your child and you and the rest of the family in overcoming this eating issue. Now, think of it as like a physical health problem. If your child were to break their arm, you most certainly would seek out good medical care because you know that you can't do this alone. You know that you can't heal your child's arm without appropriate medical care. And mental health concerns are exactly the same. We don't want parents to feel like they have to go through this alone or resolve this issue on their own with their child. Instead, we want to support you in putting together a comprehensive treatment team full of experts who know a lot about this issue and can really support you and your family, and most importantly, your child, in working through the issues related to emotional and binge eating. So none of you have to soldier this alone, okay? So what I want to talk about today are the key players in this treatment team that you want to put together for yourself, and really what the goal or the role of each person is on that team. So the first person that you want to get for your child's treatment team is a therapist or a psychologist who specializes in emotional and binge eating. Now, there are a lot of clinicians out there, from professional counselors to social workers to psychologists to marriage and family therapists. And really, what you're looking for is not so much their title per se, but more their area of expertise. You really want to pay attention to finding someone who specializes in emotional and binge eating with young children or teenagers, okay? So it's really, really important that whoever you choose is not only a good fit for your family in terms of their personality and where their office is located and their approach, but also that they have a very strong understanding of the psychological and emotional dynamics of emotional and binge eating. Because really, the last thing you want to have happen is bringing your child and your family in to work with a professional only to have them give your child and your family advice that's actually going to be counter to the recovery process. Now, a therapist or a psychologist who specializes in emotional and binge eating will typically do two main things when working with your child or your teenager. First, they're going to arm them with a lot of important skills that they can use during times of urges to overeat. So your child will hopefully be learning other things that they can do, other ways to cope with whatever is driving them to want to overeat. The second thing that this provider should be doing is then helping the child or the teenager access what is underneath the eating urges. Why are they wanting to overeat in the first place? What are those emotional or psychological pieces that need to get worked out so that the child is no longer turning to food for some type of emotional relief or soothing? So the skills, coupled with exploring the underpinnings of their relationship with food, is going to be really, really crucial in your child's overall recovery process, okay? The second provider that we want to bring onto the team is a family therapist. And this is going to be someone who is trained to work with a family system that will include your child, you, any other adults in the home, and any other children in the home. So a family therapy session may have 4, 5, 6 people. Sometimes a family therapist will work with subsystems, meaning they may ask to meet with you and the child, maybe only the siblings, maybe only the parents. But the overall goal of each therapy session is to strengthen the family unit. And family therapists typically do this by really inviting all members of the family to share their experiences, their feelings, and their needs, and help the families have healthy communication and conversations, particularly as it relates to the issues driving your child's overeating behaviors. The other thing that a family therapist can do is provide education for everyone in the family about emotional and binge eating, because we really want to make sure that everybody understands what's going on so that there aren't hurtful comments being made or comments that could set back the child's or the teenager's recovery process. Okay, so the primary goal of the family therapy is going to be to open up space for the family to have healthy, meaningful conversations with the goal of strengthening the bonds in the family dynamic. Okay? The third professional that we want to add to your child's treatment team is a pediatrician. Obviously, this is going to be the person who will be monitoring your child's health, monitoring their weight, maybe doing blood work on a regular basis, monitoring their bone growth, anything from a physical perspective that could be influenced by the emotional and binge eating. This is oftentimes the person who will be overseeing the child's weight gain or weight loss if that is an issue of concern. And they will be able to address it in a way that is not shaming for the child. So it's very important that any discussion about weight, having your child be weighed, all of that is happening at the pediatrician's office. Okay? The fourth professional that we want to make sure is on your child's treatment team is going to be a registered dietitian, and particularly a dietitian, again, who specializes in emotional and binge eating and works with children and teenagers. So a registered dietitian is someone who is uniquely trained to help educate people about proper nutrition and to do this from a non-dieting perspective. So a registered dietitian may work only with your child, depending on his or her age, may work only with the parents, depending on the child's age, especially if they're younger. Oftentimes in these cases, though, a registered dietitian will typically work with both the parents and the child and maybe other family members involved. Eating is a family affair. We eat a lot of our meals together. We do a lot of our food prep and our shopping together. So in helping a child recover from emotional and binge eating, a lot of the work around food happens as a family. And so the registered dietitian typically will work with all of you as a family. Now, some of the things that you can expect in your sessions with a registered dietitian will be a lot of questions about what rules the family has around food. Are there good foods and bad foods? Are there things that you do with food or that you don't allow with food? What are the ways in which the family interacts with food? And they will be looking to see if any of those interactions may be problematic for your particular child who is struggling with emotional and binge eating. Then the registered dietitian will work with your child and your family to try to clear up some of those struggles around food. So if there's particular foods your child has a hard time with, the registered dietitian may focus on that. If food prep is challenging or if cooking is challenging, the RD may focus on that. If eating at the dinner table together is challenging, the RD may focus on the nutritional aspects of that and then also inform the therapist that dinner time may be a stressful time for the family and may ask the therapist to explore some of those interactional patterns as well. The RD will work with the child to create a healthy relationship with food. And by healthy, we don't mean that the child is always eating healthy, because that sounds a lot like a diet, and we don't do dieting around here. But we do want the child to feel like they understand what nutritious food is. They understand that some foods are more nutritious, some foods are less nutritious, but that there's room for all foods to be in their regular day-to-day eating. So an RD is really going to teach them how to have a balanced, moderate, and varied relationship with food, which is really how we want all adults and children to be eating on a day-to-day regular basis. Okay? The last piece of the treatment team puzzle that you may or may not want to have on your particular team is a psychiatrist. Now, this is going to be a professional who is responsible for prescribing medication, psychotropic medications to be exact, if that is indicated to support your child's recovery process. Now, the therapist and the pediatrician will be people who can really give you feedback on whether or not working with a psychiatrist will be helpful for your child and for your family. In some cases, it may be very helpful, especially if we're dealing with diagnoses like depression or anxiety, maybe OCD or ADHD, which are diagnoses that can very often co-occur with emotional and binge eating. So in those cases, medication may be indicated and may be really helpful for your child's recovery process. Now, there may be other cases where medication would not be indicated. Either it appears that that would not be helpful because the issues are not necessarily going to be resolved or minimized with medication. Maybe the child is too young. Maybe the family doesn't support medication right now. So there are a lot of reasons why a family may not opt to work with a psychiatrist. But if you're not sure, speak with your primary therapist or psychologist and get their feedback and the pediatrician's feedback, and then go from there if you feel that that would be a helpful part of your treatment team. So just to recap, we're looking for a therapist or a psychologist, to work one-on-one with your child. Then we want to add in a family therapist to work with the whole family system. Then we want to add a pediatrician and a registered dietitian. So those are your 4 primary treatment team providers that really are essential for the recovery process. And then some families opt to add a psychiatrist to that treatment team as well. Now, depending on the particular situation with your family and your child, there may be other providers necessary. In some cases, we have families also working with a gynecologist or also working with a GI doctor. So there are other providers that we may add to the mix. And again, your therapist or psychologist will be the one kind of leading the treatment, and they can provide those recommendations. It is so very important that you really lean on your treatment team for guidance and expertise. You are not expected as a parent or a caregiver to know how to navigate through this. That is just impossible. What we do hope that you'll be able to do is really count on and trust your treatment team, because your role, which is the most powerful role of all, is to be there as a loving, supportive, non-judgmental figure for your child as they're going through their recovery process. Okay, so let the treatment team be the guides, hold the lantern, be the experts for you, and hopefully you trust them, you can follow their lead, and then that really frees up space for you to be that loving parent that I know you want to be for your child, that you are, because that's really going to be the absolute best medicine for your kid, okay? So on that note, I'm going to end this series next week with our final episode about what you as a parent or a caregiver can do to support your child's recovery. We've talked about the signs and symptoms. We've talked about what leads to emotional and binge eating. We've talked about which professionals can help you. And I'm going to end this conversation with the absolute most important piece, which is what you can do to support your child, because you truly, truly are the best medicine for your kiddo, okay? So I'm going to give you some very concrete things that you can do right here, right now, to support their treatment and to support their recovery process. And your child can absolutely, completely recover from emotional and binge eating. Do not believe people when they tell you that your child may have to deal with this for the rest of their life. That is just simply not true. We see it all the time that people fully recover. They find full freedom from food. It is possible. It does happen. So do not give up hope, okay? So I look forward to seeing you here next week. I'm going to give you some tips as a parent on what to do. In the meantime, start putting that treatment team together, and I will see you back here next week. Bye-bye.